This is one of the most painful conditions any person can have. It is called a pilonidal abscess, and it is formed because of an infection in these pilonidal sinuses, which is a passageway between the coccyx or the tailbone and your skin. And what happens is that often we see this in individuals who are overweight, males, those who are sitting for long periods of time, but we could also see it in women. And what happens is you have an ingrown hair that gets stuck in these sinuses and eventually over time become infected, causing fluid to accumulate, causing an infection called an abscess. And the way that we manage this is by surgery. So oftentimes we perform surgery to get rid of these infections. Here you're seeing how they perform this surgery. So the way they do it is they essentially form an incision on that passageway, and surgeons are able to get rid of these ingrown hair because the key is to remove the ingrown hair so that it doesn't accumulate and cause infection. And then they also laser this passageway to form scar tissue so the sinuses are closed so that this infection doesn't recur again. So what's important here is that if you fit that demographic of a male overweight who sits for prolonged periods of time and you're having tailbone pain, make sure you talk to a primary care provider to make sure you don't have a pilonidal abscess, because those could be life-threatening.